of our ministerial ethics. This week we'll be talking about ethics in pastoral care and counseling. Ethics in pastoral care and counseling. And under that we'll be talking about confidentiality. We'll be talking about dual relationship. We'll be talking about referral. Confidentiality. This is more professional. Okay. And sometimes some of them can also be used in pastoral ministry. I'm going to explain that shortly. Now, ethics in pastoral counseling. Ethics in pastoral care. It's not optional. It's foundational. It is foundational. It's not optional. Pastoral caregivers stand at the intersection of theology, psychology, institutional authority, vulnerable human suffering. That's where we stand. Like I told you about the book I wrote on this, which I showed you sometimes ago. Maybe this book will be useful this time. Give me a second. The book on the pulpit, pew, and psychology, navigating the intersection of faith and human experience. This may be useful for someone. I wrote the book, when was that? 2 years ago, 2025. It's the last year book. I wrote the book last year. You may need to get this book and read it. That will give you more understanding about, our role in caregiver, our role as a pastor, and where we stand. You may need to get it. It's on Amazon. You may need to get it so that you can have it in your library and read it. You'll be able to know that our duty is not just to just preach or do whatever we want to do and walk away. Our role is more intensive. Our role is more, extended, extensive. We are standing, holding so many things at the same time: theology, psychology, institutional authority vested on us as a minister, and of course, vulnerable human suffering. That is the intersection where we are standing. And ethical failure in pastoral care and counseling, can cause the following. Number one, spiritual harm. That somebody will walk away from God forever and say, because of you, he is not going to, serve that God. It can alienate someone from the Lord forever. Ethical failure can lead somebody away from God forever. Spiritual harm. Number two, psychological trauma. In this part of the world, some of us are just saying, many people don't come to church again. They don't come. If you listen to their story, many people have been abused by spiritual leaders in the time past that made people to lose interest in any institutionally based organization like church. Psychological trauma because of the ethical failure of people who have died, and it's hurting generations after them. So whatever you are doing today is not just only affecting the moment, it's affecting generations to come. Psychological trauma. Ethical failure can cause loss of trust. No, people will not trust pastor, trust leaders again. Maybe when you say you are pastors, they just look at you as a joker. Why? Because of ethical failure. Legal consequences. You can be sued. You can be sued. You can be sued. And you pay damages in court, and judge is going to ask you to pay damages for whatever. That's why we need to avoid moral failure as much as possible. And of course, damages to the witness of the church. Because the church, bear witness to the gospel. This is very, very important. And that's why ethics protect, the congregants or the counseling people we are dealing with. Ethics protect them. Ethics, protect also the pastor, not only the member or congregants or counseling or, a client. So ethics protect everybody. Ethics protect the church. Okay? Not just people, the institution. Ethics protect. If everybody can just, stay within their boundary, we wouldn't run into trouble. And of course, the integrity of the gospel. Ethics protect the integrity of the gospel. This is very, very important. Let's look at the foundational ethical, principles. What are the principles in pastoral care? In pastoral care, because as a pastor, in what you do, and some of you will find yourself in secular job tomorrow, maybe in chaplaincy or whatever area you find yourself, you need to pay attention to this. Before addressing specific issues, we must, ground our discussion in core ethical principles. Core ethical principles. The number one is called beneficence. Beneficence. They act for the good of the person. You are acting for the good of the other person. It's called beneficence. That's number one. That's ethical principle. Whatever you are doing, doesn't matter how beautiful that thing is, if it is not for the good of the people or the other person, don't do it. Okay, don't do it. Number two is non-maleficence. Non-maleficence. That is, you are not doing any harm. You are harmless. You do not harm. Non-maleficence. You do not harm. And another one is autonomy. Autonomy. It doesn't matter how beautiful whatever you are about to do, you need to respect the autonomy of the people you are. You respect the person's agency. This is very, very important. Don't forget, we've been talking about the dignity of humanity. Every human being on earth, created in Imago Dei, has agency, has right to live as the Creator wanted them to live. So we need to respect human agency, the autonomy. And of course, another one is justice. Fairness in all things, impartiality. This must be seen in our ministry because members are watching you with this side of the eyes. Even when they are not looking at you straight away, they are looking at you with this side of the eyes. They want to see your action. They want to see how you will relate with two children before you. How will you relate? You are not showing favoritism to someone and the other person, you are trying to push away the other person. No. Justice, fairness, and equality in all things. Fidelity is another ethical principle. Fidelity. Faithfulness to trust. Faithfulness to trust. This is very, very important. Fidelity. You are faithful to the trust committed to your hands. And the number 6 is veracity. That's truthfulness. Truthfulness. Veracity. Truthfulness. Don't forget number 1, beneficence, non-maleficence. Number 3 is autonomy. Number 4 is justice. Number 5 is fidelity. And number 6 is veracity, which is truthfulness. So in pastoral theology, the principle aligns with love your neighbor as recorded in the gospel as yourself, Mark 12:31, truth in love. truth in love. Apostle Paul mentioned this in Ephesians chapter 4, verse 15, truth in love. And of course, shepherding responsibly. Shepherding responsibly. According to 1 Peter chapter 5, verses 2 to 3. That's what we are called to. That's what we are called to. Let's look at those principles up there that I highlighted the other time, talking about confidentiality. Now, different contexts. In the Western part of the world where we find ourselves, confidentiality is very, very important. And what is confidentiality when we're talking about that? Confidentiality is the ethical obligation to protect information shared within the pastoral counseling relationship. Somebody came to your office and he shared a very vital information with you. Courtesy demands that matter is between both of you. It's not meant for anybody. It's not meant to be used as an example during sermon. It's not meant to be shared with anybody. We must learn to keep. If you are working in the secular world and you can't maintain that, you run into big trouble with people's information. Okay, it is not just mere privacy. It is a kind of secret trust. It's a secret trust, not just keeping of privacy or it's secret trust. When you read Proverbs chapter 11 verse 13, a trustworthy person keeps a confidence. A trustworthy person keeps a confidence. This is very, very important. Any information you have about anybody, it must not go out through you. It must not be used against that person. You have to keep it sacred information. It's a privileged information. It's not your right. They can say not to tell you, but if you have opportunity to hear it from them, you need to keep such. Right? Why confidentiality matter? Why? Confidentiality builds psychological safety. If people are sure that their information is safe in your hand, they can share it. Like somebody was talking to me yesterday, and the person was telling me that the information I'm telling you, I've never shared it with anybody in my life. So I'm only sharing it with you. It's a privilege. It's a privilege. The information she has never shared with her husband. She has never shared with anyone. She's sharing it with me. So it gives psychological safety. Confidentiality encourages disclosure. When people know that their informations are safe in your hands, they open up. Okay? It encourages disclosure. People make disclosure. They tell you deep secret, deep things going on in their heart, in their life. Confidentiality protects, dignity too. Dignity. You are a useless man if you can't keep people's information. But when you keep confidentiality, protects dignity. Confidentiality preserves trust in ministry. If you don't have the trust, if you don't have trust of your member or people you are working with, you don't have any work again. You are gone. You are finished. When people can't trust your work, your ministry, your labor, what you are doing, you don't trust it. So without confidentiality, the authentic pastoral ministry, we collapse. Without confidentiality, we collapse. We collapse. We collapse. And that's why we need to be very, very careful. However, there are limits to confidentiality. There are limits to confidentiality. Yes, we must maintain confidentiality, but there are limits. When people come into counseling, I'm speaking now as a counselor and a registered psychotherapist, we inform them that we maintain confidentiality, but there are limits to confidentiality. Yes, so we need to disclose this to them. Ethically and legally, it may be breached. That confidentiality, we can breach it when there's a risk of harm. Okay? When there's a risk of harm. Somebody is telling me that you want to go and kill somebody, or you want to kill himself, or you want to do something nasty. I can't say because I want to keep confidentiality and just keep quiet and keep. No, I have to take action about it. Somebody say you want to kill himself. Somebody say you want to kill somebody. You want to kill all his wife. I was reading a story yesterday. A man was fired in his place of work, and he began to run into financial crisis. And he's a man of the family of 6, himself, his wife, and 4 children. And the man, killed himself and killed all the remaining 5 people in the family. So people found themselves at this hopeless state sometimes when all hope are gone, when nothing more, they don't have any reason to live again. And many people get confused and all that. And they have something to speak with you, and they tell you that they're going to do this. You have to take it serious, and say, I have to keep up. No, confidentiality does not get to that point. Or somebody's abusing child. Somebody comes to you, and they are abusing children. You have to talk about it. A couple comes to you, they are fighting in the presence of their children. You have to report it to child agency. That is our work. That is our work. I know some of you will have questions about that. No problem, we can talk about it. I'm talking now as a professional. If children's interest, we must put that first. If a child is raised in a toxic atmosphere, it can lead to trauma that child will nurture for the rest of his life or her life. So that's why we need to be sensitive to all these things. Or elderly abuse. So when we see all these things, we need to report it. Okay, we need to report it. Another area when we break limits to confidentiality is if courts subpoena us. They ask us to bring record. We receive judge is asking us for a document or a particular information about anybody. You can't keep it from the court. You have to release the document. All you just need to do is that the area they need, they will let you know. You open it up, and while you blunt the other areas, you don't have to release people all the information of people to the court. The area they need, you just leave it out, and other area you come. There's a way we do that. So court can ask for documents. Based on that, we break confidentiality if we are subpoenaed by court to bring a document. And of course, for those of us who work with supervision, some of you will be working with Archdeacon, and your supervisor will be asking you about somebody he asks you to visit. I say, no, I know a priest like that his boss, the supervisor, asks him to go and visit somebody. He will go and visit the person, and by the time he comes back, he won't report back to the supervisor. The supervisor will be asking him how far about this, and he won't give any information about that. No, you have to break confidentiality in that sense because of supervision or supervisory consultation. You need to know what you have done in that situation. Somebody is having an emergency situation, and your boss asks you to go there to go and do something. You have to come back and report back whether you have done the right thing. Otherwise, if you need to follow up, he will do that. You don't say, it's my information. No. For supervisory consultation, even when done appropriately and within minimum identifying information, you still have to give, some information. Another thing we will talk about here, beside the limit of confidentiality, is informed consent. Informed consent. Before you do counseling, pastor should clarify what confidentiality means, its limits, situation where reporting may be required. This will protect both parties. All right? Informed, because you need to let them know. And if they need to sign a document, let them sign. Generate a document and let them sign it. Looking at it from the pastoral and clinical side, context, pastor must recognize in some jurisdiction, clergy are mandatory reporters. In some jurisdiction, I don't know how it happens in United Kingdom and in United States, but in some jurisdiction, clergy are mandatory reporter. In Canada, we are mandatory reporter. So if any abuse is going on around me, I have to report. I have a duty to report it. Church settings, do not exempt one from legal responsibility. Please. The fact that you're a clergy does not exempt you from legal responsibility. We need to understand that ethical pastoral care or counseling requires the knowledge of the province where you are, the state where you are, your municipal, your reporting obligation, what you are expected to do, and documentation standard. How do you document all these things? We need to familiarize ourselves with our municipal laws and provincial law. We need to familiarize ourselves and know what is going on around us so that when there's a need for us to report, we'll be able to do the right thing. This is very, very, very important. Another aspect we need to look at today is the area of dual relationship. When we talk about dual relationship, it occurs when a pastor or a leader has more than one role with a person. You have more than one role with one person. That's dual relationship. Let me give an example. A vicar or a reverend and a business partner. You're a reverend and a business partner with your member. That's a dual relationship. Or a pastor and an employer. Or a pastor and close friend. You are a pastor and you are a close friend. You are a pastor, you are an employer. That's dual relationship. Pastor and family members. Sometimes if anybody in your family needs support, you need to refer that person to another person because of familiarity. Pastor and romantic interest. That's dual relationship. Okay, you are a pastor and you want to be having romantic relationship with that member. No, you can't do that. That's dual relationship. In church setting, dual relationship are very common. Very common. But they are dangerous if unmanaged. If you don't manage it, it's very, very dangerous. Let's look at why dual relationships are risky. Why are they risky? They can create power imbalance. They can create emotional dependency. They can create boundary confusion. And they can create exploitation, whether intentional or unintentional. It's very, very risky. They can create power imbalances. Imbalance. Number 2, emotional dependency. Number 3, boundary confusion or boundary, violation or boundary crossing. And of course, exploitation. So, because, pastor holds spiritual authority. That authority must never be misused. 1 Peter chapter 5 verse 3 says, not lording it over those entrusted to you. You're not lording anything. When you begin to lord things on people, then there will be power imbalance, there will be emotional dependence, there will be boundary confusion, boundary crossing, violation, exploitation. This is very, very important. There could be sexual dual relationship. Sexual involvement with a counselee or a member is ethically prohibited. It is not allowed. Spiritual abusive. When you have sexual involvement with your member or counseling, it's spiritually abusive. It is ethically prohibited. It is professionally disqualifying or vocationally disqualifying. It's often, legally actionable because you can be sued as a pastor, even if consensual. And I think I've mentioned this sometimes. Even if it is consensual, the power imbalance invalidates genuine consent. Please, let's take note of this. How do we manage inevitable dual relationship, unavoidable dual? How do we manage it? In small churches, total avoidance may be impossible. And I know some of us in United Kingdom, we are just planting new churches. Our churches are small, our members are few. Sometimes it's difficult to avoid dual relationship. So therefore, you need to clarify boundary early with anybody. Clarify boundary early with people you are dealing with. Limit depth of whatever you are doing. When conflict exists, you have to limit it. Don't keep going. When conflict exists, you must learn to limit, your depth you are going. And at the same time, when you notice that things are getting out of hand, make a referral where necessary. Make a referral. When you notice that the objectivity is compromised, make a referral or seek supervision. Talk to the senior clergy. All of us need support. Until we retire, we'll continue to need support from others, from colleagues, from friends, from family. Looking at the power and pastoral authority, ethics cannot be separated from power. When you separate ethics from power, there's abuse of that power. So pastoral authority involves, spiritual influence. It involves access to vulnerability. It, involves institutional leadership. A lot of privilege. Can you see? That's why we have to be very, very careful. So ethical misuse of this following I've mentioned, these three, includes, number one, spiritual manipulation. Number two, you use scripture to control people. Some people use scripture to control people. You force dependency. You force people to depend on you. And of course, sometimes you withhold the information. That's ethical misuse of your spiritual influence, your access to vulnerability, your institutional leadership. So ethical ministry require a lot of self-awareness and humility. A lot of self-awareness and humility. We talked about referral the other time. Referral occurs when a pastor directs a member or a counselee to another professional due to scope limitations, due to complexity of the matter on ground, due to conflict of interest, due to lack of competency or competence. That can bring about referral. If you are dealing with a case that is higher than you, why can't you refer to senior people to deal with it? This is very, very important. This is very, very important. Or issue involving your wife with another church member. You can't preside over that case. You can't. Issue involving your children with other church members' children. Allow other people in the church who are matured or your assistant, whatever, to take over that case because of the conflict of interest. And when to refer, when you notice that the case you are dealing with is a mental health issue, is a serious or severe depression or anxiety or bipolar or psychosis, you refer. Don't manage. In so many churches today, they are managing mental health issues. We are not equipped to do that. Refer to professionals. All right? Refer to professionals who can do that. Or when somebody is using substance dependence, let's refer. Or somebody is experiencing suicide ideation, a suicidal risk, or legal issue, or when you are out of your depth, you are exhausted, you are tense, you are stressed out. Ethical practice requires recognizing your limits and place yourself within that jurisdiction. Theological concern about referral. Some pastors fear that referring, implies lack of faith or spiritual inadequacy. No, no, this is false. That's not true. That's not true. Referral, reflects wisdom, reflect humility. Humility. It reflects responsible leadership. That's what referral means. Luke was a physician. Paul recommended medical care, right? Spiritual care and clinical care are not enemies. Just remember me saying, I don't want to take injection. I have faith. No. We refer them, still ask them to go to the hospital when necessary. Don't ask someone to believe in God alone and why the problem persists. And how to refer ethically is to explain why referral is beneficial. That's the first thing to do. Explain why referral is beneficial. Avoid shaming language. Avoid shaming language. You need to provide reputable options. Reputable options. And of course, you continue pastoral support where necessary, where appropriate. So referral is collaboration with the person you are referring to, not abandonment. You are not just referring them and walk away. It is collaboration, not abandonment. And of course, documentation and accountability is very, very important. Pastors should keep minimal but responsible notes of whatever you are doing. Anything can happen tomorrow and they can ask for it. Keep your notes. Store record, securely. Protect digital confidentiality. If you save things on your computer, passworded it and don't leave your system open. Unauthorized person must not have access to your system, your computer. Use encrypted communication when appropriate. Passworded email, messages, emails, PDF. Passworded them when necessary. Because ethical ministry includes also administrative diligence and competence. Administratively, we must be up and doing part of our work. Whatever you are doing, keep record of whatever you are doing. Ethical decision-making model. Ethical decision-making model when facing an ethical dilemma. The situation is dicey. I will give you 7 of them and I will close this class today. What are the ethical decision-making model when you are facing ethical dilemma? Number 1, you need to identify the problem. Identify the problem. Number 2, clarify role and power dynamics. Roles and power dynamics. Number 3, review theological and legal standards. Theological and legal standards. You need to review that. Number 4, consider consequences. You need to consider consequences. Number 5, seek consultation. Number 6, you need to pray for wisdom. And number 7, you need to act transparently. Act transparently. Now, there is an assignment I'm drawing out for this, which we are going to submit. It's going to be our major assignment for this class. You are going to divide yourself into 4 groups. Divide yourself into 4 groups. And I'm going to give you a case study that each group is going to review. Okay, case study for discussion. I am going to write your report and submit that. And that will carry some percentage of mark. case study analysis is 20%. Case study analysis is 20%. So you need to start that this week 7 and week 14, right? When we are writing our final exams, which is 35%. So please let's bear that in mind. I'm going to put the details of that on our platform so that you can have access to it. So I'm going to write out the groups. Don't worry, I will divide you into groups and I will post it on our platform. And we'll start from there. I hope this will help you. With the readings of this week, please take time to review that. This week we are reading True and chapter 5, Pastoral Care Ethics. So, and of course, that's going to help us to move forward fast. We're in week 7, so we'll have our test, a mid-semester test in week 8, by the grace of God. So until I come your way again, I hope you enjoy the new week and be blessed. God bless you. Take care, everyone.